Hi, my name is Bill Gundelfinger, also known as Mr. Medicare, and it's currently April 10th, 2025, as I'm recording this. And there have been some new developments with regards to Medicare, and I wanted to keep everybody in the loop. On April 4th, this last week, CMS, Centers for Medicare and Medicaid Services, released an update. This is the first update that has been released under Robert F. Kennedy, Secretary of Health and Human Services, and Dr. Mehmet Oz, the Administrator for Centers for Medicare and Medicaid Services. The final rules relate mostly to the 2026 plan year, starting in January of next year. So let's dive into this. So first of all, there are a number of rules that were previously proposed by the Biden administration that are now under review. What we're interpreting this to mean is that it's very unlikely that these will ever go into effect. These rules include things like the annual health equity analysis of utilization management policies, procedures, and ensuring equitable access to Medicare Advantage services. These are what are commonly known as the DEI rules that were implemented or were being implemented under Medicare. Those are being reevaluated as it stands right now, and I would be very surprised if we ever see them go into effect. There's another rule that's being reconsidered or reevaluated, and that is guardrails for artificial intelligence. As AI becomes more prominent in our lives and infiltrating throughout all of our lives, Medicare wanted to make sure that there were some guardrails to make sure that the artificial intelligent engines didn't get out of control. Those are under review. And then finally, this is under review technically. However, more recently now, they've actually announced that it's not going to happen. And this is the anti-obesity medication coverage by Medicare Part D. This was on the slate to be implemented for 2026 by the Biden administration, and the current administration has reversed course now and said that anti-obesity medications will not be covered by Medicare Part D. This would include drugs like Ozempic and Wegovy, as well as others. I'm going to come back and talk about those at the end of this video, so to give you some additional information, so stay tuned. Now, moving on, creating rules to close some loopholes related to Medicare Advantage plans are in the works right now. So some of the Medicare Advantage plans, many people feel, have been taking advantage of these loopholes to get out of paying claims and sticking everybody else with them. So there are some new rules that are being implemented to close some of those loopholes. Also, they are changing the rules for dual special needs plans. Dual special needs plans are Medicare Advantage plans that are available to Medicare and Medicaid eligible enrollees, people that are eligible for both Medicare and Medicaid. So they're setting up some rules to change that eligibility or to change the plan offerings themselves, and in theory anyway, make them work in a more streamlined manner. Also, most of the rules that were specified in the Inflation Reduction Act that was signed into law now over 3 years ago are being or have been codified, meaning they're being made permanent parts of the Medicare program. This includes the $35 insulin maximum copay under Part D. It includes the Medicare prescription drug payment program. It includes the Medicare prescription drug national negotiation program. This is where the government's going to negotiate the maximum fair retail price for lists of medications. They've already released their first 10, which we've covered in the past. They've identified the next 15 medications that are going to go under negotiation that should be starting very soon. This includes Ozempic, Wegovy, Ibrance, Linzess, Otezla, as well as a number of other medications. This program is moving forward. We were very happy to see that happen. And then finally, the maximum out-of-pocket limit and the elimination of the donut hole are still in place for next year. Again, it would be difficult to get out of that since it was passed and passed by Congress and signed into law. However, do keep in mind that that maximum $2,000 out-of-pocket limit adjusts from year to year due to inflation. So they've determined that next year now, the maximum out-of-pocket limit will be $2,100. Finally, back to the Ozempic and Wegovy and the weight loss medications. I want to make sure everyone is aware of this, that these medications are, in fact, covered by Medicare if they're being used for a Medicare allowable condition. Simply using them for weight loss is not. However, if you've got diabetes, or if you have heart conditions, or if you have even sleep apnea, these are allowable conditions, and many of these medications are approved to treat these conditions. Just recently, we saw a customer of ours get turned down for a formulary exception to cover her Ozempic for weight loss. When they went back in, because she had previously been diagnosed with sleep apnea, so when they went back in and applied for that same exception to be used for sleep apnea, it was approved. So keep that in mind. Again, diabetes, certain heart conditions, and sleep apnea, many of these medications are approved to treat and will be covered under Medicare Part D if they're being prescribed for those purposes. So I hope this helps everybody, and we'll catch you next time.